everyone. Today, I'll be presenting on a critical yet often overlooked global health issue, adverse childhood experiences, or ACEs. But first, here's a little bit about me. My name is Julia Weissman, and I'm a rising freshman at Vanderbilt University in Nashville, Tennessee. I'm very passionate about addressing pediatric mortality in public health crises and aspire to work in the field of pediatrics. I've participated in science research involving glioblastoma or brain cancer, and in high school I was co-captain of the Beacon debate team, and outside of school an active volunteer with many local organizations. I also work with Peer Health Exchange to better the mental health care field for over 400,000 youth nationwide. While much attention is rightly given to crises like war, displacement, and the climate emergency, we often forget the long-term, invisible toll that these events take on the most vulnerable, children. ACEs such as abuse, neglect, and household dysfunction don't just shape childhoods, but reshape brains, alter stress systems, and increase the lifelong risk of mental illness, chronic disease, and early death. Drawing from neuroscience, public health data, and global policy frameworks, I'll explore how early adversity disrupts brain development and, more importantly, what we can do to prevent it. Approximately 64% of the adults in the United States reported having experienced at least one type of ACE before the age of 18. In fact, nearly 1 in 6 adults reported that they had experienced 4 or more types of ACEs. A 1998 ACE study by Dr. Rob Anda and Dr. Vince Folletti, conducted with Kaiser Permanente patients, revealed just how widespread childhood trauma truly is. Over 1 in 4 respondents reported growing up in a home with substance abuse, more than 1 in 4 experienced physical abuse, and over 1 in 5 had been sexually abused. While these findings were striking at the time, the problem has only intensified. More than 2 decades later, reports of ACEs have increased, driven in part by the effects of the COVID-19 pandemic, rising global displacement, and ongoing violence in various regions across the world. Across the globe, children are experiencing trauma at staggering rates. In Yemen, nearly 80% of school-age children in Sana'a show symptoms of PTSD. Corporal punishment remains widespread in many regions and is strongly linked to anxiety and academic difficulties. In the U.S., Native American and Black children report disproportionately high ACE scores, reflecting systemic inequities. And in Ukraine, early data points to neurodevelopmental disruptions in children exposed to the ongoing war. These aren't isolated cases, and they reflect a global pattern of early adversity with lasting health consequences. Today, I will be referencing a landmark study I learned about in a psychology class called Neurobiological and Psychiatric Consequences of Child Abuse and Neglect. This study has neurobiological findings that come from a review of clinical studies involving adolescents and adults with confirmed or self-reported histories of childhood abuse or neglect, typically occurring before age 18. Subjects were assessed using neuroimaging, hormonal analysis, and psychiatric evaluation, with most data gathered in late adolescence or adulthood. The hypothesis of this study is that early life stress, including child abuse and neglect, causes persistent alterations in neurobiological systems which increase vulnerability to psychiatric disorders later in life. Let's take a closer look at the limbic system, which is the brain's emotional center, and early life trauma can disrupt its development, leading to long-term difficulties with fear, stress, memory, and emotional regulation. First, let's look at how early life stress impacts these neurobiological systems. Key areas of the brain include the hypothalamic pituitary adrenal axis, or the HPA, the amygdala, and the hippocampus. Chronic childhood trauma alters key brain structures. The amygdala, which processes fear, becomes hyperactive, leading to a heightened threat sensitivity, emotional dysregulation, and increased risk for anxiety and PTSD. The hippocampus, critical for memory and stress regulation, shrinks under prolonged cortisol exposure, impairing memory and emotional control, hallmarks of depression and PTSD. Trauma also disrupts the HPA axis, the body's stress response system, resulting in abnormal cortisol levels. This dysregulation contributes to mood disorders and raises the risk for physical conditions like heart disease and immune dysfunction. Trauma survivors show a 30 to 50% increased risk for PTSD, depression, and anxiety. There's a strong correlation with personality disorders as well. So, we are forced to ask the question, how does early life trauma increase vulnerability to psychological disorders in adulthood? Well, first, there's a strong correlation between childhood trauma and later diagnoses like depression, PTSD, anxiety, and substance use. Second, behavioral studies show that traumatized individuals often have difficulties with emotional regulation, decision-making, and managing stress. And finally, brain imaging reveals that trauma leads to structural and functional changes, especially in the limbic system and prefrontal cortex, which are areas critical for emotion and mood regulation. So what can we do as a society to address this problem? Well, the CDC recommends strengthening economic supports for families, including state-dependent care tax grants and the Child Care and Development Block Grant, to reduce household stress and improve child outcomes. Globally, frameworks like INSPIRE and the Nurturing Care Framework offer scalable, evidence-based strategies to reduce violence and promote early development. Embedding trauma-informed systems across healthcare, education, and humanitarian sectors is essential. If we aim to improve global mental health and reduce the burden of disease, we must begin where the risk begins, in childhood. Here are a few acknowledgments and resources I used for this presentation. Additionally, if you believe you are a victim of child abuse or know someone who is in distress, please contact these various resources. Thank you so much for listening to my presentation, and thank you to the Johns Hopkins Global Health Leaders Conference for another amazing summer.